morning. I'm just going to go over a little bit about the first meeting and some of the progress, but I'm not going to try to bring every meeting in because the meetings of the American Laser Society meet every year. What? It's not going to go, huh? All right, the original developers of the American Laser Society were these two gentlemen. On the right side, Elliot Drake, and on the left side, the more important person to me, at least, was Leon Goldman. Now, Leon Goldman started using lasers in the early 60s. He was primarily famous for his use of the ruby laser, and it was primarily for dermatology, and as Isaac likes to tell us frequently, it was not a cutting instrument. It never was. The organization at the present time is devoted to developing expertise in laser physics, laser research, laser biology, and predominantly in laser safety. And that was the original organization. The organization began in March of 1979. 280 scientists were invited to come to San Diego, California. 140 actually did arrive, and the first meeting began. They've had meetings every year since. And they had originally, to start, a large grant of money, which was given them by the William Mark, who was then heading up the A. Ward Ford Institute. Mr. Mark died in 1980, but every year there's an award given to some laser scientist throughout the world who has earned special merit. The first of these was given in 1982 to Dr. Goldman. That was at the annual conference at Hilton Head Island in South Carolina. These are some of the members who've been given honorary memberships, who are also members of the International Society. Theodore Maiman, of course, who was the developer of lasers in general. Peter Asher for his work in neurosurgery. Dr. Atsumi for all of his work in developing. Isaac Kaplan for his development of the International Laser Society and for his development of an actual functional CO2 laser. Peter Kiefhofer got a special award for his work using endoscopic lasers to control GI bleeding, which was very good at the time. And Dr. Patel, who worked in New Jersey at that time at the Bell Laboratories, and actually developed the CO2 laser. So he got a special award. There obviously are lots more. There's a long list of awardees, and I'm not going to bore you by just giving you a litany of all these people. A lot of them are members of our organization. They're right here. The Journal of the American Laser Society is the Lasers in Surgery and Medicine. It was first edited by Billy Aronoff and Gene Friedman, and edited successfully for a number of years. It's been in continuous usage since the late 70s, and currently is one of the larger journals devoted to laser techniques and laser information. The next editor was Raymond Lazafam, who was at Rochester, where there's a large laser institute at the Rochester General Hospital, and Ray ran the journal for the next 20 years. Currently, the editor is Stuart Nelson, who's at the Beckman Institute, which is at the University of California in Irvine, and is one of the larger institutes of the world devoted purely to laser research. That's all it's done there. The home office is in Wausau, Wisconsin, in the United States. I like to mention that because I think that's key. I think one of the things that has always troubled me about the International Society is that we never had a central office, an office that didn't move. The Society's office moved every 2 years to wherever we were going to have the next meeting. I think the foresight of Leon Goldman was to have a single place. Of course, that was obligated because that's where the Institute was that founded, money-wise at least, the American Laser Society. So it's in Wausau, Wisconsin, the large office, and it has never moved from Wausau, Wisconsin. And that's a great advantage. That's where the treasurers are, that's where the Secretary General is, and everybody else. So it's helpful. Current membership is 4,300, including physicians in more than 41 medical specialties, a large contingent of nurses who belong, physicists, biomedical engineers, biologists, and equipment manufacturers. Where's Penny? Is Penny here? Penny there. Try something you've been trying to do for many years, but the American Laser Society did it for you, with you, many years ago. Actually, nursing division of the American Laser Society was developed in '83, and by '86 it was a separate division completely within the American Laser Society, devoted to laser nursing, which is an important part of what we do. This is a typical meeting. It's the largest conference on laser therapy and biology held in the United States. They average about 300 to 400 scientific papers and a large number of commercial exhibits. This is just a sampling of one of the smaller conference rooms at the last meeting. The next meeting is April 14th through 18th, 2010. It'll be in Phoenix, Arizona. For those of you who are so inclined, you're welcome to attend. It's going to be, Phoenix is a beautiful area, especially in Scottsdale, which is where the meeting is actually going to take place. The membership, although it's 4,300, the usual attendance at the meetings is anywhere from 2,800 to 3,000 at these meetings. So it's been a very successful organization. I wanted to show you this one because these are some of the original members. Does this work at all? Nope. Well, anyway, we have on your left-hand side Leon Goldman, Dr. Arndt, Dr. Burns, and Dr. Yako. Yako was also active, very active in this organization. He did a lot of head and neck surgery. Leon Goldman, of course, we all knew because he was so active in every laser organization. All his work being in ruby lasers, and a great interest he had in laser art, where he did a lot of etching with lasers. Arndt was one of the first presidents. Michael Burns I'd like to show because he's very important to those of us who live in Southern California. Michael Burns went out and got a major grant from Dr. Beckman to form the Beckman Laser Institute, which is a large institute on the campus of the University of California in Irvine, which is devoted purely to laser research. The clinical part is over at the main campus, but this separate building is only for research, and it's quite impressive. Thank you.